On the NCLEX, the loud emergencies are easy points. Anyone can prioritize the patient clutching their chest or screaming in pain. But the real test of a safe nurse, and where most students fail, is spotting the quiet ones. Today, we are skipping the easy stuff. We are tackling 25 vague and silent danger priority questions, where the difference between stable and critical comes down to a single, subtle clue. Question 1. A nurse is making early morning rounds. Which client requires assessment first? 1. A client who is complaining that the room is too cold. 2. A client who suddenly reports, "I feel very dizzy when I sit up." 3. A client who is asking what time breakfast will arrive. 4. A client who is quietly watching television. The correct answer is 2. A client who suddenly reports, "I feel very dizzy when I sit up." The rationale. Sudden dizziness when changing position may indicate hypotension, arrhythmia, hypoglycemia, stroke, or pre-syncope. This is a potential perfusion neurologic problem and a high fall risk, so it requires immediate assessment. Incorrect options. 1. Feeling cold is a comfort issue, not a sign of acute deterioration unless linked to other symptoms like shivering, hypotension, or sepsis. 3. Asking about breakfast shows the client is awake, oriented, and perfused enough to think about routine matters, not urgent. 4. Quietly watching TV suggests stability. They're awake, breathing, and interacting with their environment. Clinic RN test day tip. On the NCLEX, suddenly plus neurologic symptom, dizzy, confused, weak, should ring danger bells every time. Question 2. The nurse hears different breathing patterns from client rooms. Which client should the nurse check first? 1. A client breathing at 10 breaths per minute with a regular rhythm. 2. A client breathing at 24 breaths per minute with a regular rhythm. 3. A client is snoring softly while asleep. Or 4. A client whose breathing is irregular with pauses and varying depth. The correct answer is 4. A client whose breathing is irregular with pauses and varying depth. The rationale. Irregular respirations with variable depth can indicate brainstem dysfunction, opioid overdose, increased intracranial pressure, or impending respiratory arrest. Pattern changes are more dangerous than rate changes. Incorrect options. 1. A respiratory rate of 10, if regular and the client appears stable, can be acceptable, especially in sleep. 2. A rate of 24, wild tachypnic, may be compensatory for pain, anxiety, or fever, and is less immediately ominous than irregular breathing. 3. Light snoring is common and not inherently dangerous unless accompanied by apnea, desaturation, or choking. Clinique RN test day tip. Don't get distracted by the number alone. An abnormal pattern almost always beats fast or slow in priority. Question 3. The nurse does a quick walk-by of several rooms. Which client requires priority assessment? A client who is lying in bed, staring at the ceiling, and not responding to questions. A client who is pacing in the hallway and talking to themselves. A client who is sitting in a chair reading a magazine. A client who is smiling and talking with a visitor. The correct answer is 1. A client who is lying in bed, staring at the ceiling, and not responding. The rationale. A client who is awake but non-responsive may have altered mental status, seizure activity, stroke, hypoxia, or severe psychiatric dissociation. This is a subtle but serious neurological red flag. Incorrect options. 2. Pacing and self-talking suggest anxiety or psychosis, but the client is awake, mobile, and interacting. 3. Reading indicates intact attention, vision, and motor skills. 4. Smiling and talking with a visitor is reassuring for cognition and perfusion. Clinique RN test state tip. Awake but not truly responsive is way more dangerous than awake and acting odd. Question 4. Which client should the nurse see first? A client who is refusing to eat breakfast. A client who is asking for help reaching the bedside table. A client who was previously talking but now suddenly has slurred speech. A client who is upset about the noise level in the hallway. The correct answer is 3. A client who was previously talking but now suddenly has slurred speech. The rationale. New slurred speech is a classic sign of stroke, TIA, hypoxia, or CNS depression. Because it is a sudden change, it requires immediate assessment and rapid stroke protocol. Incorrect options. 1. Refusing food is common in illness and not immediately life-threatening. 2. Asking for help with objects shows appropriate cognition and awareness. 4. Being upset about noise is a psychosocial concern, not a physiologic emergency. Clinique RN test day tip. On the NCLEX, speech changes mean brain changes until proven otherwise. Question 5. The nurse is observing several clients on the unit. Which client is the priority? 1. A client sitting on the edge of the bed and appears unsteady. 2. A client lying in bed and yawning repeatedly. 3. A client reading in a recliner. 4. A client talking on the phone. The correct answer is 1. A client sitting on the edge of the bed and appears unsteady. The rationale. Unsteadiness while sitting suggests dizziness, orthostatic hypotension, stroke, or impending syncope, and a high risk of falling. Incorrect options 2, 3, 4. Yawning, reading, and phone calling all reflect stable neurologic function and perfusion with no immediate danger described. Clinique RN test day tip. If your NCLEX client looks like they're about to fall, they instantly climb to the top of your list.
By the way, if you want to practice these same style questions, check out the Clinique RN Q-Bank. It's got everything you need to level up your prep. AI feedback system that explains every answer in plain English. Cat mode so you can train under real NCLEX conditions. And a summary sheet to help you review and track your progress after every session. It's like having your own personal NCLEX coach in your pocket. You can sign up for free using the Clinique RN link in the description and start practicing right after this video.
Question 6. Which client requires the nurse's immediate attention? 1. A client who is annoyed that breakfast is late. 2. A client who reports mild, dull back pain. 3. A client who is resting with eyes closed and regular breathing. 4. A client who stops talking mid-sentence and then just stares ahead. The correct answer is 4. A client who stops talking mid-sentence and then just stares. The rationale. Abrupt interruption of speech and staring can indicate stroke, seizure onset, syncope, or acute neurologic decline. This is a classic sudden change scenario. Incorrect options. 1. Irritation about food is not a physiological emergency. 2. Mild back pain, while uncomfortable, is not immediately life-threatening. 3. Quiet rest with regular breathing is reassuring. Clinique RN test date tip. Anytime a stem gives you suddenly stopped, suddenly changed, suddenly different, then think high priority. Question 7. During evening rounds, which client should the nurse assess first? 1. A client who is crying softly after a phone call. 2. A client who is diaphoretic and saying, I feel weird. Something is wrong. 3. A client who is complaining of boredom. 4. A client who is asking what time visiting hours end. The correct answer is 2. A client who is diaphoretic and saying, I feel weird. Something is wrong. Diaphoresis plus vague feeling of doom can be a prodrome of MI, PE, stroke, severe hypoglycemia, or shock. NCLEX loves this combination as a red flag. Incorrect options. 1. Crying shows emotional distress, but not necessarily physiological instability. 3 and 4, boredom and asking about visiting hours show adequate cognition and perfusion. Clinique RN test date tip. Vague statements like, I feel weird, plus physical red flags like sweating, chest pressure, SOB, are always serious. Question 8. Which client is most concerning? 1. A client who reports being tired after physical therapy. 2. A client who is mildly short of breath after walking to the bathroom but recovers quickly. 3. A client who's sitting upright, leaning forward, and breathing rapidly. 4. A client who is frustrated that their medication is late. The correct answer is 3. A client who is sitting upright, leaning forward, and breathing rapidly. The rationale. Tripod-like positioning and tachypnea signal respiratory distress, COPD exacerbation, asthma, PE, or pulmonary edema. Airway and breathing issues are top priority. Incorrect options. 1. Tired after PT is expected. 2. Mild self-limited exertional dyspnea that resolves is less concerning than ongoing distress at rest. 4. Frustration about meds is psychosocial, not acute. Clinique RN test day tip. When the body chooses a position like leaning forward or sitting upright to breathe, believe it. That's compensatory. Question 9. The nurse is observing from the doorway. Which client should be assessed first? 1. A client whose lips appear pale and slightly blue-tinged. 2. A client covering their head with a blanket because of the bright lights. 3. A client asking for more pillows. Or 4. A client who is drowsy but awakens easily when called. The correct answer is 1. A client whose lips appear pale and slightly blue-tinged. Rationale. Cyanosis, even mild, suggests hypoxia. Combined with pallor, this points to poor oxygenation and perfusion and must be evaluated immediately. Incorrect options. 2. Light sensitivity and wanting darkness can indicate headache or migraine, but not necessarily critical instability. 3. Pillow adjustments are purely comfort-related. 4. Drowsy but easily arousable is common in hospitalized clients, not the top priority here. Clinique RN test day tip. If something looks blue, lips, nail beds, tongue, your brain should instantly shout, check oxygen. Question 10. Which client should the nurse see first? 1. A client who reports a generalized mild headache. 2. A client whose face suddenly appears weaker on one side. 3. A client is complaining that lunch is delayed. 4. A client asking when they can shower. The correct answer is 2. A client whose face suddenly appears weaker on one side. Rationale. Sudden unilateral facial weakness or droop is a stroke red flag. Time-sensitive interventions, like thrombolytics, depend on rapid detection. Incorrect answers. 1. Mild headache is common and nonspecific. 3 and 4 both represent non-urgent needs. Clinic RN test day tip. Unilateral means think stroke. One arm, one leg, one side of the face, one-sided vision loss. Question 11. Which client requires immediate evaluation? 1. A client complaining of difficulty falling asleep. 2. A client who is restless and keeps changing position in bed. 3. A client who is asking to speak with the provider about discharge plans. 4. A client who is difficult to arouse and only mumbles when their name is called. The correct answer is 4. A client who is difficult to arouse and only mumbles. Rationale. This represents decreased LOC, which may be due to oversedation, stroke, hypoxia, hypercapnia, sepsis, or hypoglycemia. The client may not be protecting their airway. Incorrect options. 1 and 2. Insomnia and restlessness are uncomfortable but not immediately life-threatening. Option 3, requesting discharge discussion shows adequate mental status. Clinique RN test day tip. LOC is your 6th vital sign. If they barely wake, you don't wait. Question 12. The nurse hears different sounds from the hallway. Which client needs assessment first? 1. A client who is lightly coughing while speaking normally. 2. A client who is sneezing several times in a row. 3. A client whose breathing sounds gurgly and irregular. 4. A client who is clearing their throat occasionally. The correct answer is 3. A client whose breathing sounds gurgly and irregular. The rationale? Option 3, correct. Gurgling plus irregular respirations suggest secretions, aspiration, or airway obstruction. This is an airway problem and must be addressed quickly. Incorrect options. 1, 2, 4. Coughing, sneezing, or throat clearing alone are usually protective reflexes with patent airways. Clinic RN test day tip. On the NCLEX, noisy and irregular breathing almost always beats coughing in priority. Question 13. Which client requires immediate assessment? A client who is annoyed about not getting coffee. A client who is staring at the wall and does not respond when spoken to. A client who is pacing and saying they are worried. Or a client who is watching TV with the call bell in reach. The correct answer is 2. A client who is staring at the wall and does not respond. The rationale. Awake but non-responsive means altered LOC, seizure activity, stroke, or severe disorientation, high-risk neurological status. Incorrect options. 1, 3, 4. Annoyance, worry, and TV watching are all interactive behaviors showing preserved cognition and airway. Clinic RN test day tip. Someone who looks awake but can't engage is never fine. Question 14. Which client should the nurse see first? A client who is complaining of being hungry. A client who says, I feel tired after my walk. A client who suddenly reports, the room is spinning. A client who is frustrated with a roommate. The correct answer is 3, a client who suddenly reports the room is spinning. The rationale? True vertigo, room spinning, can indicate stroke, cerebellar dysfunction, or severe hypotension, especially when sudden. Incorrect options. 1, 2, 4. Hunger, expected fatigue, and frustration are low acuity. Clinique RN test day tip. Dizziness, vertigo, or spinning described as sudden is frequently tested as a stroke clue. Question 15. During routine checks, which client is most concerning? 1. A client rubbing their temples and saying they have had a mild headache all day. 2. A client whose breathing pattern has become more shallow and irregular over the last few minutes. 3. A client who is asking for ice chips for a dry mouth. Or 4. A client who is quietly journaling in bed. The correct answer is 2. A client whose breathing pattern has become shallower and irregular. The rationale. Worsening shallow, irregular breaths suggest developing respiratory failure, fatigue, or CNS depression. This is more urgent than mild chronic headache or comfort issues. Incorrect options. 1. A mild all-day headache is uncomfortable but stable and nonspecific. 3. Dry mouth and request for ices is a comfort or hydration issue, not critical. 4. Journaling shows stable cognition and fine motor control. Clinic RN test day tip. If breathing is getting worse right now, that's your priority, even if other symptoms look dramatic. Question 16. The nurse is rounding at night. Which client should be assessed first? A client who cannot suddenly hold onto the bed rail with one hand as well as before. A client who reports feeling sleepy and asks to have the lights turned off. A client who says, "I'm bored, there's nothing to do here." Or a client who is restless and shifting positions in bed. The correct answer is 1. A client who cannot suddenly hold onto the bed rail with one hand as well as before. The rationale? New unilateral weakness or poor grip can indicate stroke, progressive neurologic disease, or acute neurologic change. Sudden motor changes are top priority. Incorrect options. 2. Sleepiness at night with normal interaction is expected. 3. Boredom is not physiologic instability. 4. Restlessness can be pain or anxiety related, not necessarily emergent. Clinique RN test day tip. Pay attention to new weakness, even if the question doesn't shout stroke explicitly. Question 17. Which client should the nurse check first? 1. A client who is refusing to participate in physical therapy. 2. A client quietly holding their chest with a grimace but not calling out. 3. A client who is annoyed about the television volume. 4. A client who is asking when the nurse will return with a warm blanket. The correct answer is 2. A client is quietly holding their chest with a grimace. The rationale? Chest discomfort plus pained facial expression is highly suspicious for MI, angina, PE, or other cardiac events, even without dramatic complaints. Incorrect options. 1. Refusal of PT is chronic and non-acute. 3 and 4, both are comfort or environment matters. Clinique RN test day tip. Don't wait for the client to verbalize chest pain. Body language counts. Question 18. Which client requires priority assessment? A client who is asking for assistance to adjust the blinds? A client who suddenly drops their fork and says, "My hand feels funny." A client who is mildly short of breath after laughing hard but recovers quickly. A client who is irritated that there is no Wi-Fi. The correct answer is 2. A client who suddenly drops their fork and says, "My hand feels funny." The rationale? Sudden abnormal sensation plus dropping an object equals possible stroke, peripheral nerve issue, or evolving neurologic event. High priority. Incorrect options. 1, 3, 4. Blinds, transient breathlessness after laughing, and Wi-Fi frustration are non-urgent. Clinique RN test day tip. Losing control of objects plus funny feeling in a limb equals stroke clue until proven otherwise. Question 19. The nurse completes evening rounds. Which client should be evaluated first? 1. A client who is asking for help finding the TV remote. 2. A client who is diaphoretic, gripping bed rails, and breathing faster than before. 3. A client who is resting quietly with eyes closed. 4. A client who is requesting a different flavor of juice. The correct answer, 2. A client who is diaphoretic, gripping bed rails, and breathing faster than before. The rationale: a combination of sweating, gripping bed rails, and increased RR suggests acute deterioration. MI, PE, sepsis, or shock. Incorrect options: 1, 3, 4. Remote, quiet rest, and juice preference are low-priority issues with no evidence of hemodynamic instability. Clinic RN test day tip: NCLEX loves combos. 2 or 3 subtle red flags together usually beats a single obvious complaint. Question 20. Which client is most concerning? 1. A client who reports that their chronic knee pain is still there like always. 2. A client who is asking what time the game will be on TV. 3. A client whose lips and nail beds appear bluish. 4. A client who is irritated about frequent vital sign checks. The correct answer is 3. A client whose lips and nail beds appear bluish. The rationale: central cyanosis means critical hypoxia, threatening brain and heart perfusion. Incorrect options: 1. Unchanged chronic pain is expected. 2 and 4. Both show intact cognition and non-life-threatening complaints. Clinique RN test day tip: don't ignore the color change. Blue always comes before boredom or irritation. Question 21. A nurse is doing a quick round. Which client should the nurse prioritize? 1. A client who refuses to see visitors today. 2. A client who keeps repeating, "I don't feel right, something is terribly wrong." 3. A client who reports feeling lonely and wants to talk. 4. A client who is annoyed about hospital food. The correct answer is 2. I don't feel right, something is terribly wrong. The rationale: sense of impending doom is a classic early sign of MI, PE, anaphylaxis, or major physiologic decompensation. Incorrect options: 1, 3, and 4, all emotional psychosocial concerns without physical red flags. Clinic RN test day tip: something is wrong, I can feel it, should never be ignored. NCLEX treats it as serious. Question 22. Which client is the priority? 1. A client with a respiratory rate of 24 per minute, regular and unlabored. 2. A client with noisy, gurgling, irregular respirations who is not clearing secretions. 3. A client who is coughing occasionally and then resumes talking. 4. A client with nasal stuffiness and mouth breathing. The correct answer is 2. Gurgling, irregular respirations. The rationale: suggests airway obstruction, ineffective clearance, aspiration, or respiratory failure. Incorrect options: 1. Mild tachypnea but stable pattern. 3. Coughing while talking means still protecting the airway. 4. Nasal congestion is uncomfortable but not emergent. Clinique RN test day tip: airway always beats mildly abnormal vitals in priority questions. Question 23. Which client requires immediate evaluation? 1. A client who is refusing to participate in group activities. 2. A client whose smile is suddenly crooked on one side. 3. A client who is asking for a warm blanket. Or 4. A client who is stretching after being in bed for hours. The correct answer is 2. A client whose smile is suddenly crooked on one side. Rationale. Crooked smile with sudden onset means facial nerve involvement, often stroke-related. Incorrect options. 1, 3, and 4, group refusal, blanket request, and stretching mean non-urgent. Clinic RN test day tip. Teach students to spot fast. Face droop, arm weakness, speech changes, time to act. Question 24. A nurse is doing late-night rounds. Which client is the priority? 1. A client who cannot be awakened with normal verbal stimuli and only moans when shaken. 2. A client who is awake in bed scrolling on their phone. 3. A client who is complaining that the hallway lights are too bright. 4. A client who is asking when the nurse will bring their medications. The correct answer is 1. A client who cannot be awakened with normal verbal stimuli. The rationale? This is a significant decrease in LOC and could indicate respiratory depression, sepsis, stroke, metabolic imbalance, or overdose. Incorrect options. 2, 3, and 4 all demonstrate adequate alertness, orientation, and interaction. Clinic RN test day tip. If they barely respond, you don't delay. Decreased LOC means an emergency.
Question 25. Which client requires immediate intervention? 1. A client who is restless because they can't sleep in hospitals. 2. A client who is confused and actively trying to climb out of bed. 3. A client who is journaling about their hospital stay. 4. A client who is asking what time it is. The correct answer is 2. A client who is confused and actively trying to climb out of bed. The rationale is confusion plus unsafe mobility means fall risk, plus possible delirium, hypoxia, sepsis, stroke, or drug effect. This is both a physiologic and a safety emergency. Incorrect options. 1. Restlessness from poor sleep is common and not dangerous by itself. 3. Journaling shows intact cognition and coordination. 4. Asking means oriented. Clinique RN test day tip. On the NCLEX, confused plus mobile is far more dangerous than confused plus sitting in bed.
Hope this sharpened your clinical judgment. For more free NCLEX tools, click the link below to sign up. Like, subscribe, and comment below with what topic you want to cover next. See you in the next video.